Hi, I'm Dr. Deepthi. I'm an emergency physician and consultant at Avanta Healthcare Private Limited. Let's talk about geriatric rehabilitation. Starting with the famous proverb, let's add years to age and not age to years. Aging is not a disease, it is a natural phenomenon which has to be nurtured and advanced. During this aging process, there is decline in muscle strength, there is a decline in cardiac reserve, respiratory reserve, and there is a lot of psychological and physiological changes due to aging per se. Geriatric rehabilitation is an emerging field and challenging field in the field of rehabilitation. Here we aim to restore the function and enhance the residual functional capability to improve the quality of life. It is a science of healing. Here we focus on function and well-being and not exclusively on diseases per se. Geriatric rehabilitation requires a multidisciplinary approach involving medical sciences and allied medical sciences. Medical care includes managing comorbidities, timely health checkups, investigations, and immunization. Nursing care, wherein you help the patient to give the patient effective and supportive care by maintaining the health hygiene and also giving the proper positioning to the patient and timely medications and every supportive management as a best nursing care. Then comes physiotherapy, which involves providing the mobility aids, strengthening muscle strengthening exercises, physiotherapy for pain, gait exercises, and also avoiding frequent falls and making them more independent. It also includes giving a proper nutrition and diet to these patients, which is very important for their immunity and well-being. Sometimes we may also need a swallow specialist or a diabetologist and immunity specialist or optometrist to provide them a hearing aid and to assist swallowing and also to assist their vision. Importantly, we have to prevent risk of fall and also have to assist the risk of fall by giving them the mobility aids and also making sure that they get the good strength of muscles and they do a good exercise and their pain is managed, because with the age they will have a lot of issues with the posture, with the gait. They will have head thrust, forward bending of the spine, and also they will have osteoporotic changes, and because of weaning and old age group, they belong to the most vulnerable part of our society. So it is very important to give them all that they need. So give them the emotional, social, and physical support that they need and promote their good health and well-being. Thank you.